These are some pictures. There's a small surgical incision that's done on the back of the child's leg to lengthen some of the tendons. This does not affect the child as the child grows, and the legs are straightened. As you can see the progression, this is how the child's leg was when it was born. Can you notice the acute angles? This is the same child. It was treated soon after birth. The plaster cast was applied, and the special shoes were given. And this is the child at about 3 or 4 years of age. As you can see, the legs are almost 100%. You will get more than 90% improvement with this method. Now, please imagine the impact this will make on the lives of the child and the family. In Tamil Nadu alone, with a population of 16 million, approximately 2,500 children are born every year with Clubfoot. And these are the statistics in the different hospitals. In ICH, Egmore, we treated 350 people. And all the other hospitals put together is 472. Now there is an alarming rate of dropouts, and even more importantly, we're only catching about 20% of all the children we expect are being born in Tamil Nadu with the Clubfoot. So the remaining 2,000 of them are getting treated. Some of them, we are expecting that about 1,000 of them are getting treated elsewhere, but another 1,000 of them will probably not be getting treatment. And they will end up with a severe disability for the rest of their lives. So, what can we do about it? There is an organization called CURE International, which focuses on correcting disabilities due to the Clubfoot. CURE International it operates from around the world. And in India, it's working with a number of the state governments, Tamil Nadu, Delhi, Karnataka, Bihar, and they run clinics in all the government hospitals. But at this point, the shoes that we're talking about, they're not funded by the government. So these sets of specially designed shoes are still being purchased by CURE and by other people who have donated money for this project, and are being provided free of cost to the children below the poverty line. So what does CURE do? CURE talks about the Ponseti method, because that's what it is. The Ponseti method is the method of correcting the child's foot by using a simple set of these shoes and prosthetics. They maintain the medical records to follow up on the research, and they provide counselors, because a very important aspect is that we need to educate the people. Tamil Nadu has excellent health parameters, but as you can see, we're still getting only about 500 out of the 2,500 children we expect are born with this condition coming into the hospitals. And CURE also distributes the braces free of cost to the children for about 3 to 4 years. I'm from the Rotary Club. The Rotary is an international organization. It's a social service organization. We're more than 100 years old, and we try to do what we can to help with the underprivileged. Rotary, as you're probably aware, has been very big in the eradication of polio. We have spent over $1 billion trying to provide the drops free of cost to children all around the world. And Rotary District 3230, which I'm a part of, which is based out of Chennai and in Tamil Nadu, we have partnered with CURE to try and make sure that no child unnecessarily starts walking like somebody in that video we saw. So what are we trying to do? We're trying to spread awareness of the problem and how easily disability can be prevented. You're all aware that today is World Disability Prevention Day. And so it's particularly apt that I should be speaking to you all today. We're trying to mobilize resources for this project. because there's a huge amount of expenditure involved. There is a big dropout rate, and if the shoes are not changed on time, then the benefits of the process is lost. So a child goes through about 8 to 10 pairs of the shoe before the whole process is completed. So there's a fair bit of expenditure in the shoes, in the plaster casts, and so on. And roughly, we're expecting that it costs about 10,000 rupees per child, because each one of these shoes costs about 1,200 rupees. Now this is an extremely reasonable thing, as you can imagine, because for 10,000 rupees we're really helping that child walk like a normal person for the rest of their lives. What about you? Why are we talking to you? You are an opinion builder. People will come and ask you for advice. You can help them understand what are the possibilities available to them. You are an expert resource, and you can help raise resources. Rich or poor, unknown or famous, this particular ailment can touch us all. There's a family who had a child with a clubfoot deformity, and the father is telling the son a little bit about the whole condition. This can happen to anyone. It can happen to you, it can happen to me, and it can be easily prevented. I wanted to take this opportunity to talk to you about this, because together we can completely wipe out this condition in our country. It requires a little bit of awareness and a little bit of willpower to make this happen. We are particularly lucky because we have Mr. Michael Steenbeek from the Netherlands. He's from Cure International, and he is the person who actually designed this. We have him here with us today, and I'd like to invite Mr. Steenbeek to come on stage for a couple of minutes. Steenbeek works extensively in Africa and other parts of the world, and I'd like to ask him to share his experiences with us for a couple of minutes on how this process started, how something as simple as this can become so effective.